Posterior periapical x-rays, capturing clarity from crown to root. Posterior PAs can be a really difficult x-ray to obtain, so in this session we're going to review proper patient positioning to get the ideal image. For adults, we recommend using the Jazz Solo sensor for posterior PAs. This is the larger of the two sensors and offers the image area of a size 2 sensor with the comfort of a size 1. The goal of a posterior PA is to also see the entire root, entire crown, and have open interproximal spaces of the premolar and molar teeth. Remember to be mindful of the angle that the cord comes out of the sensor to avoid having the patient bite down directly onto it. For posterior PAs, the cord will come directly from the sensor to the outside of the mouth like this. For posterior PAs, we'll use the yellow easy positioners in a way that allows the cord to come directly out of the mouth. We do always recommend using the positioners to get the best possible image and prevent accidental movements or misalignment of the sensor. There are 2 yellow positioners because you'll use one of them for the upper right and lower left and the other for the upper left and lower right. Usually the operator will take the x-rays in that order so that you only have to change the positioner once. On adults, you usually need to take 8 posterior PAs to see everything, 1 molar and 1 premolar x-ray in each of the 4 areas of the mouth. If a patient has their wisdom teeth or are missing teeth, you may need to take more or less x-rays. Start with the upper right molar PA. You use the yellow positioner that allows the setup to look like this. Position the sensor as far back on the top right as you can and center it on the molars. Have the patient bite down slowly on the positioner. You're trying to see the very back or distal of the last molar all the way up to the distal of the last premolar. Next, you'll move more forward in the mouth and center it on the upper right premolars. You'll want to see the distal of the last premolar through the distal of the upper right canine. Now, just keep the sensor and positioner exactly as they are and you'll move on to the lower left teeth. See how the positioner works the same for both of these areas of the mouth. Start with the lower left molars and then move on to the lower left premolars. Now you'll switch the positioner to the other yellow one. Start with the upper left molars and then move to the upper left premolar. Then it's the same thing. Keep the sensor and the positioner the same and move it on to the lower right to finish up the series. You'll take one of the lower right molar and one of the lower right premolars.